with people who are unable to attend today. And we'll also be sharing the chat, but that will just be for our notes. If you'd prefer not to be identified at any point, just flag that or direct message me, that's fine. And please could you remember to remain on mute when you are not talking. So hello everyone, and welcome to today's Faculty of Public Health session on climate change and health. Communications, organised by the Faculty of Public Health Special Interest Group on Sustainable Development. My name is Emily Loud. I'm a Public Health Registrar in the East of England, member of the Special Interest Group, and I will be chairing today. And a big thank you to all the other SIG members who've helped to organise this session and who'll be supporting today, particularly Anna Brooke and Sue Atkinson. So hi, and thank you for attending. The reason we wanted to host this session is because we know from discussions from and also from surveys with people within the special interest group and more broadly, that many public health professionals really want to be champions for climate change and health. But many also don't feel quite confident enough communicating on this topic, which can be a real barrier to action. So to help us all understand how we can better overcome these challenges, particularly in relation to sort of external audiences like the public, media and politicians, we have three fantastic speakers with us today. We're going to be hearing from Kate Llewellyn, who's Head of Training and Engagement at HEARD, which is a UK charity working to inspire communication that changes hearts and minds. We have Professor Ed Maibach, who is Director of the Centre for Climate Change Communication at George Mason University in the US, and who is here very early in his morning, so thank you very much. And we also have Matthew Green, who is Global Investigations Editor at DeSmog, where he leads coverage of the global climate crisis and related issues. Each speaker will have sort of 10 to 15 minutes to share their key insights and tips on climate change and health communications, and then we will roll over into a joint Q&A session. So please feel free to put your questions in the chat while our speakers are talking, or you can save that for that section. Finally, we'll have an opportunity for peer discussion in breakout rooms to digest what everyone's learned and come up with any final questions. We'll aim to finish by 2:30 UK time, and we want to keep to time, so speakers, if you're approaching the 15-minute mark, I will give you a quick message just to let you know. And finally, just to note, this is the first of several webinars and an ongoing programme of work to support Faculty of Public Health members on climate change and health communication. So we have another webinar planned for September, and we also hope to set up smaller groups for peer learning in the autumn. So throughout the session, please think about what you might find useful next and let us know when we send out the evaluation form. So without further ado, I'd like to hand over to our first speaker. So Kate, the floor is yours.
Lovely, thank you, Emily. Thank you all so much for inviting me along. I'm really excited to be here. And the reason for that, other than my enthusiasm, will become quite apparent when I talk through the research. I thought what I could do today is share a bit of information about where your audiences in the UK are at when it comes to climate change, and some research, some framing research that points to how we can move those audiences into feeling differently and more kind of that sense that we can actually fix it on climate change. As Emily said, I work for a charity called HEARD. We are all about making sure that voices are not just kind of raised and amplified, but they're actually acted upon. So everything I'm sharing with you here today is research that you can use when you're talking about climate change to your peers, to your kind of colleagues, and also if you are doing media work or if you're kind of working on external communications, all of this will be helpful there. Now, slightly outrageously, I'm actually going to start off with a question to you. And this question is, what sort of person rates their interest in environmental issues as 8 to 10 out of 10? Or what sort of person is really interested in environmental issues? If you are happy to just throw this into the chat, I think people can do that, yes, because people have been writing them before. Throw it in and we'll see where we get to. We've got the first one out the gate from Rachel, younger people, and Ed's agreeing, maybe Ben. Any difference, any kind of disagreement with that? Any other ideas? Shannon, the average UK resident, Anya, people who care about justice, all ages. Very interesting responses coming in. Young people, vegetarians, people who are very kind of involved, maybe more affluent people with more time, left-leaning, people with grandchildren. I love this. Okay, keep those coming, and I'm going to reveal the answer. Now, actually, I think this is only the second time in a workshop that I've shared this and I've had the correct answer. So this is very thrilling to me. This is based on BBC research, which looks at kind of the different audiences that BBC engages with, which is kind of really a lot of people here in the UK. And what it found was that every different demographic group had lots of people who rated their interests as very high in environmental issues. And this speaks to something really interesting in terms of what is happening here in the UK, that actually everybody is really quite worried, very interested, and that doesn't really change depending on where you live, your ethnicity, your level of economic kind of wealth, whether you're left-leaning or right-leaning. Of course, there is an interest when it comes to kind of people's action and their kind of desire to see change, but what we do have is very, very high interest. And I wanted to start off with this because we can now move past that story of having to convince people that we have a problem. And now we can move the story into what we can do to create that change. A little bit more on where your audiences are at here in the UK. So they know that there's an emergency and they care. But what we're seeing at the moment is people can really struggle to see those big picture solutions. People don't really readily connect kind of fossil fuel extractions, what that means with net zero policies, what that means for reducing fossil fuel use, and ultimately tackling climate change. And we are increasingly fatalistic. 58% of young people feel that humanity is doomed. And that's not just young people experiencing this. 75% of all adults are really worried about the impact of climate change. So the good news is that people accept that there's a problem. But the bad news is that many don't believe that it can be fixed. Now, that's where our research comes in. And also the fact that we can still act, I should say this. So we know from the IPCC that, you know, we are at a crossroads. We do have the tools and the know-how required to limit that warming. So we always kind of take the science to make sure we're kind of still going along the right tracks. So how we talk about climate change really matters. And what I'm going to be sharing now is 4 principles from a literature review that we held a few years ago that we test to make sure it's still robust. This literature review brought together the best communications research, looking at British audiences mainly. And it thinks about not so much the messaging advice, but those deep ways to move lots of people into feeling differently on climate change. And it's built off this idea that actually we do think in common ways. So certain values and ideas have almost universal resonance across Britain. And that's from some other research that I definitely recommend looking at, which is Britain Talks Climate Outreach's audience segmentation. So getting stuck into it, because I've got my eye on the time, Emily, I'm making sure to keep to it. So the first principle that we have is about making the issue doable. This is about kind of making sure that we're telling stories that point to solutions, that point to the fact that we can fix it. And it's all about kind of for every ounce of urgency you have in your communication, you have an equal ounce or more of the fact that we can fix this. Now, I want to be clear though here, I'm not saying that this is about positive framing. That would be disingenuous and it doesn't land with audiences. And I think hopeful framing isn't enough. I definitely don't mean crisis framing in the sense of everything is ruined. What I'm talking about here is that sweet spot of can-do framing. You know, the challenge is there, but we can change this. We do face a lot of issues, but we can improve this. It is within our reach. It is doable. And the reason for this is we are seeing so many people who are feeling more fatalistic on climate. And research is really clear that the more we kind of tell people there's a problem, we don't show there's a way out of it, the more likely those people will turn away from the issue. They'll be less keen to engage. They're less likely to kind of vote with their feet. and we really need to bring people along with us. So what does this look like in practice? I'm going to point to Kate Blanchett here, who was being interviewed about Prince William's Earthshot Prize campaign. And something that I think Kate does really well is she brings in that sense of balancing the urgency with the fact that we can fix it. So Kate said, there's no greater challenge facing us as a species than climate change. She sets out the problem. Then very quickly, she moves to the fact that we can fix it. She talks about the fact that as humans, we're capable of a lot, and she points to the solutions that are out there. If you can point to specific solutions, that's really, really helpful. I'm going to move on to the second principle, which is normalizing action, not inaction. Now, what I mean by this is the sense that we need to tell stories of the change that is underway and the fact that we need more of it, rather than saying things like, nobody cares, our house is on fire, we're all going to kind of hopelessly, not be able to get through this. And the reason for that is, as humans, what we think is normal really matters. And some researchers in a really great book called The Power of Us pointed to this. And what they found in this book is that we are influenced by a startling degree by what we believe everyone else is thinking, feeling, and doing. Now, this is essentially perceived norms, what we perceive everybody else to be thinking and feeling. And it matters when it comes to climate change, because what we have at the moment is 81% of people in the UK knowing there's an emergency and wanting more action to tackle it. And that's really good news. But some researchers were looking into whether people kind of really understood that. And they wanted to find out whether people agreed with the statement. So they said, okay, say agree to this or not. I myself am not worried about climate change enough to change my lifestyle and urge governments to act. I'm going to kind of do the big reveal here. So 16% of people agree with that. So that's in keeping with that 81% point. They then asked people to say whether they agreed with this statement. Other people are not worried enough about climate change to change their own lifestyle or urge governments to act. Now, I'd be curious at this point, do you think that this percent of people that agreed with this statement will be higher or lower than that 16%? Feel free to write it in the chat if you would like to guess. So you think higher, yeah, resounding higher, and you are bang on the money. 73% of people think that other people do not worry enough. And this speaks to an issue that we have in climate change. We believe that other people don't care. As humans, we're influenced by what we believe other people are doing. So if we're telling stories about climate change that normalize the fact that people don't care, we are making the issue worse. So we need to really lean into stories that normalize action. And I think to kind of bring this to life, I have a clip of a quote from Ellie Goulding speaking about how she loses followers every time she posts about climate change. Now, that is one of her truths, but another truth is that she actually has a huge following of people who are so grateful for the fact that she's speaking out. And so that's the kind of story we need to tell, like Prince William does. He says the fact that more and more businesses and politicians are answering the call, how we have kind of so many young people across the world who are uniting. Now, in the sorts of kind of areas we're working in, we'd probably be saying, we are seeing change underway and we need more of it. Because of course, we can't just pretend everything's fine, but always lead with the fact that change is happening and we need more, rather than there's not enough change. Third principle, this is why I was so excited to come and speak to you all. One of the pieces of research that was really clear was that we can talk about climate change in ways that connect the planet's health with our own health, that show that our health is dependent on the planet thriving. Now, this is important because sometimes it can be really hard to convey meaning and to help people understand why it really matters. And the other part of the research shows that because climate change and the planet is quite difficult to understand, using the planet as a body and that metaphor really helps people to engage. So seeing that in action, maybe before you'd have lent on only speaking about a science story, and instead you can talk about it in terms of health. So our health depends on us having a healthy planet. our actions hurt the planet, but they can also help heal our world. And you'll notice here the health language that's being used here. I really love health language because it's very can-do by nature, but also you can change it up. You can make it relevant to your role. And we have a few nice examples of how people have talked about reviving our world. Metaphors like our forests are our planet's lungs. How Prince William talks about repairing the planet. And I think very quickly, I'd love to just show you a clip from the sadly now ended Holby City. I don't know if anybody's a Holby fan out here. This is a little bad quality clip I have taken from a scene where a child is talking about the changes he would like to see in his hospital.
Our planet has a terminal disease. We're to blame. But there is hope. There is treatment. And if we start now, we can help it to recover. You, of all people, know about making things better.
And what it does so beautifully there is it really brings in the sense that it's all about health, our health, the planet's health. And I think it's a really kind of can-do example there. Okay, I'm going to move on to my last principle because I won't share all 6 today. And this is about keeping it down to earth. We can sometimes find it hard when we're talking about climate change to make sure it is relevant to everybody, that the language we're using is straightforward and it brings us all in. And the reason this matters is based on a piece of research that looked at the impact of jargon. Jargon doesn't just kind of make people feel ambivalent. It makes people feel bad about themselves and bad about the issue at hand. So if we kind of want to bring people into the conversation about climate change, it's really important we do so in very simple terms. Now, what do we mean though when it comes to jargon? I wanted to leave you with this idea that actually some research that looked at kind of well-known terms and phrases when it comes to climate change pointed to the fact that net zero is still really not very understood. So even terms like net zero that we would maybe use more frequently and more kind of comfortably, about half of your audience still wouldn't really connect with that. So I'll stop there. Thank you so much. And I'm looking forward to taking any questions later.
Thank you so much, Kate. That was really amazing and some really appreciative comments in the chat as well. For those who didn't join us right at the beginning, we'll be holding a Q&A session for all 3 speakers once they've all finished. So, but you're very welcome to post your questions in the chat or save it for then. So whichever works for you. So next, I'd like to invite Ed to share his insights as well. Thank you.
All right. Are you able to see my screen?
Yeah.
Excellent. All right. So good afternoon, everybody. It is such a pleasure to be with you. You are all my friends already because, like you, I am a public health professional. I actually just realized when listening to Kate talk that it was 40 years ago this month that I got my master's in public health. So this is I'm completing my 40th trip around the sun as a public health professional. And everything that I say is going to amplify what Kate has already said. And it was a last minute switch that Kate decided to go first. And that was perfect because she's bringing to you some extraordinarily good communication advice from a very general perspective, general communication research perspective. And interestingly and importantly, she brought it right down to earth. It connected with us as health professionals. So I'm going to share with you the results of the research that my colleagues and I have been doing with Americans who are a little quirky. We all know that to be true, but based on what Kate has shown us, we are not all that different than you as a people. Many of the ways we think about this issue are similar. And like Kate, I'm actually going to start by posing a question to you. This is a question that I have posed to almost 40,000 people now in nationally representative surveys twice a year since I guess the first time was the fall of 2008. Before we ask people any other questions about global warming, we ask them this question: what's the first thing that comes to mind when you hear those words? And then we, like we just did, we have them type their answers in. It's open text. And then we analyze that text. And what we have learned is that most people do think of global warming as an environmental issue, which based on Kate's research might be a good thing. I'm actually convinced that it's not necessarily a good thing, but we have to help people think about it more broadly. So the top response by far is polar bears. We get plants, penguins, polar bears. We get a variety of different species that are not human as our most common response. The second most common response, we get notions that refer to science. This happens to be the Keeling curve, the famous CO2 concentrations at the top of the mountain in Hawaii, which is how we know that one of the ways we know that CO2 is accumulating in our atmosphere, but people give us these rather abstract references as their top of mind association, references to science, which is interesting, but not necessarily personally engaging. The third most common reference that we hear are references to politicians. But it's really important to understand that when people reference politicians, they're usually referencing a politician from the other party, a politician they do not like or trust. So the political reference is rarely a positive reference, a reference that shows that people care and are themselves engaging. More and more, we are beginning to see references to extreme weather. That is absolutely, we think that's quite helpful because extreme weather references means it's concrete, means they show that there's risk already, but rarely. And I will actually go way out on a limb and say never in those 28 different surveys that we've conducted, never have we heard a top of mind reference to human health, to people's children's health, to their loved ones' health, to their own health. We rarely even get any reference at all to people that they care about, unlike politicians, people that they don't care about. And our research, like Kate's research, is really clear that when people understand, when it's top of mind association is their own people are endangered by our changing global climate, that's when we see a whole variety of different indicators that they are getting involved in meaningful ways, taking meaningful actions, or as Kate said, that they are themselves making it doable. So in the 40 years that I've been in the field as a public health communication expert, that's my niche in public health. I'm a communication scientist I got my training in communication science because I intuited that we don't solve the world's big public health problems, our community's big public health problems, unless we get the messaging right. Communication is a powerful tool that creates the conditions necessary for individual behavior change, as well as for collective behavior change in the sense of smarter public policies that undo the problem and remake the conditions in our communities so that we can enjoy better health. And the one thing in my 40 years in the field that I've become more sure of than everything else is that there really is a formula for effective public health communication. In fact, it's a formula for effective public communication of any sort. But it's certainly true of public health communication. And we know that because there's been so much research on what makes public health campaigns effective. And what it is simple, clear messages that get repeated often by a variety of trusted and caring voices. But each of those are necessary components. I'm going to go through them very quickly, but if you want to know more about the evidence that supports this, we just published this paper, it's referenced on the bottom left of the slide, in the annual review of Earth and Planetary Sciences, where we really go through all of the social science research that substantiates my claim that this is the formula for effective public communication, public health communication, and climate communication. So we take the results of our polling and we use it to predict the outcomes that we care most about, the outcomes that are most important if society is going to get on board and put in place the conditions that are necessary to limit global warming and create a healthy planet so we can have healthy people. And it's incredibly simple. The predictors of a whole variety of different actions that are important, including predictors of support for assertive public policy responses to global warming, it really comes down to 6 key ideas. They are all based in fact, which is why I call these 6 key facts about global warming. And these 6 key facts about global warming that are such strong predictors of who's taking action and who isn't, they can be conveyed in 12 words. Okay, so this is my first pitch for the importance of simple messages. You know they're simple if you can convey them in 2 words each. But here are the 6 key facts. It's real. Global warming's happening. It's us. Human activity is the main cause. That experts agree. A very, very conservative estimate, as at least 97% of the world's climate experts are convinced, based on data, not based on their own belief system, but based on data, that human activity is warming the planet, that it's bad, that the impacts of climate change are serious, and in relation to us, it's bad because it's harming our health, and it's already affecting our health, our children's health, our grandchildren's health, but it's going to get much worse unless we take necessary actions. Which takes me to the 6th key fact, and this is very much Kate's message to us all. There's hope. There are actions we can take that will make a big difference. And the sooner we take those actions, the bigger impact we can have in terms of dealing with our biggest problem and remaking our world so as to actually it be a world in which people can live even more healthfully than they are living today. And then finally, also Kate's key point to us, others care. Her point is so spot on, not only in the UK, but here in the US as well, that the majority of people are concerned about climate change, but they think they're in a very small minority. When we tell them, when we show them even better, the data, like the data that Kate just showed us, that no, if you're worried, you're actually in a large majority. That helps. People who understand that are much more likely to roll up their sleeves and get involved in bringing about actions that will make a difference. So the second point, so that was the simple, clear messages. Those are 6 simple, clear messages that we know make a big difference. Repeat it often. Why in the world do we have to repeat it often? Why can't we just say it once and move on? Well, this is research from a research team, a communication team actually, called Potential Energy. And they've been doing research on how often do we have to say it in order for it to catalyze people to take action. And they're using online message exposures, going into doing Facebook ad tests and what have you. And this is their conclusion. Based on the data, our best guess is that the average person needs to see and hear about climate change at least 80 times a month, potentially even more, to become an active supporter of significant climate action. 80 times per month. I want to hear Matthew's response to this later, but Matthew knows that the issues that are covered in the news, they do get mentioned in the news at least 80 times a month. Climate change is not one of those issues. In our survey research in the US, most people say they hear about climate change in the news only a few times per month, not 80. So achieving message repetition is super important if we're going to activate people, and we are nowhere near that critical mass yet. But that's where we can use our trusted voices to try to make a difference. Which brings me to the final element of simple, clear messages repeated often by a variety of trusted and caring voices. And guess what, my friends? That's us. We have those trusted and caring voices. This is 2022 data from surveys conducted by Ipsos in, 40 countries or something or more. Doctors, health professionals are the most trusted voice worldwide. I didn't flag UK data for you, I'm sorry, but I am going to flag US data for you because it reveals a very interesting fact. And that is not so much in the UK, but here in the US, it's my conservative brothers and sisters who are furthest behind in understanding the realities of climate change. So if you look at, I mean, and I'm sure you all know that to be true, but when we ask people in our surveys, how much do you trust or distrust each of the following as a source of information about global warming? They, on average, all registered voters, they tell us they trust their primary care doctor as much as they trust climate scientists, their friends and family, and NASA, America's leading science institution. It's pretty darn incredible that people trust their primary care doctor as much as they trust NASA and climate scientists as a source of information about global warming. But then look over at the right-hand side of this slide. This is the important part for us here in the US, and I would contend it's important for those of you in the UK as well, and that is conservatives who tend to trust all sources of information less about climate change than liberals. They are particularly likely to trust their primary care doctor, which I interpret, by the way, to mean the healthcare professionals that they know and have come to trust because they're trustworthy. We are trustworthy. We take actions that are in the public's interest. So we have earned this trust. And one way that we can now use this trust is by helping people understand the connection between planetary health, as Kate said, and our health, human health. So there are 8 distinct ways in which climate change is harming our health. I'm not going to really go over these now in great detail because we don't have time today, but air pollution is one of them, extreme heat, extreme weather, vector-borne illness, waterborne illness, foodborne illness, impacts on our food and food systems, and ultimately mental health harms, okay? All of these things are ways in which our changing climate globally and locally are harming our health already. What we've done, and in this report that's on the right, show the photo, the cover photo shown, it's called Medical Alert, Our Climate Change is Harming Our Health. It's published by an organization that's run out of my center called the Medical Society Consortium on Climate and Health. To produce this report, we wrote 8 short passages, each about 150 words, that talked about what's happening in our climate, how is that harming our health, and whose health is most likely to be harmed. And then we had people read those, give us feedback on those short essays, and before and after reading those short essays, 1,200 words, give or take, in total, we measured their cognitive and their affective engagement in the issue. And what we showed is that immediately after, and again, 3 months later, when we contacted them again, people who read these 1,200 word answers to what's happening, how's that harming our health, and whose health is being hurt first and worst, it increased their cognitive and affective engagement in the issue. And true to our survey research, which shows that we are particularly trusted with conservatives, that's exactly whose views changed the most in response to reading those 1,200 words. As Kate also said, people aren't all that interested in the risk information. They're interested, but only to an extent. They're very much more interested in the benefits information, the positive side of the story, the things that we can do that will make a difference to improve both planetary health and human health. And it really comes down to what I call these 5 policy solution pathways: clean, renewable energy and reducing energy waste, favoring climate smart foods, farms, and food systems, supporting clean and active transportation in our communities, improving our buildings in our homes so that they are fundamentally less wasteful and fundamentally more health enhancing, and then finally improving the designs of our communities. We know these are the very actions that we need to take. We know that there are policies that will help us take all of these actions, make all of these actions easier for everybody in our community, in our country to take. When we talk about these actions for their climate benefits, we're essentially asking people to be patient because the climate benefits take years, if not decades, to accrue. And they accrue sort of worldwide everywhere in a small measure. But when we talk about the health benefits of these policies, these smart planetary and human health policies, the health benefits accrue almost immediately, and they accrue primarily in the community that takes these actions. So it's a beautiful flipping the whole situation on its head. By talking about the health benefits, we're able to promise people with a straight face that they will begin to enjoy the benefits of these actions almost immediately and in their own community. We've done research that shows that the optimal message talks about all three things that Kate talked about. That we show the health impacts of climate change, that we identify the policy solutions that will make a big difference, and that we affirm helpful social norms. The fact that many of us, or even we've actually shown that, flipping it on its head and talking about, but not enough of us are taking these actions. Either one of those ways of invoking a social norm makes people more likely to contact their elected representatives. And this is true especially for conservatives, which is, again, really an important breakthrough. One last element of messaging, something that Kate didn't talk about, but we've tested only relatively recently. It hasn't yet been published, but it will be soon. I'm quite confident because it's really exciting research. And that is, if these things that I talked about a moment ago, these benefits, these solutions are so good, well, why haven't we done them already? And the answer is because fossil fuel CEOs and their lobbyists and certain politicians who are in their back pockets are financially self-interested in us not taking those actions. So by bringing them into our messaging, by calling them out by name, not by name as in their first name and their last name, but by name as in the category of who they are in our society, fossil fuel CEOs and their lobbyists and the politicians in their back pocket, that strengthens people's resolve and again makes people more likely to contact their elected representatives to demand assertive climate action. And again, it's quite curious, but this messaging, calling out the opponents, actually is more effective with conservatives than with liberals. So this is our unique value proposition. This is how we as health professionals can turn the situation around, because we have a unique role, and our climate and health narrative makes the problem personal, brings the benefits of solutions into the present and into our communities, and it helps to depolarize the issue. I know I'm long, so I'm not going to go into this in any detail, but for the past 20 years, we've all been working to try to improve the social determinants of health because we've come to understand how important they are. But in this paper that I published with Courtney Howard and others earlier this year in Lancet Planetary Health, we make the case that it's the ecological determinants of health that are even more fundamental. Because when we disrupt the ecological determinants of health, most importantly, our climate, then that has a destabilizing and eroding, it will destabilize and erode all of the social determinants of health, which in turn harm our health systems and harm our health quite directly. So this is my conclusion. This is at least the conclusion that gets me out of the bed every morning, and that is that our climate and our health have a common enemy, and that common enemy is fossil fuels. So on behalf of Sue Atkins and myself, we invite you to become a climate and health champion with an organization that we serve on the board of. It's called the Global and Climate Health Alliance. Take your camera out, point it at this QR code. It will take you to our sign up page. You will, if you give us your name and your email address, we will let you know when there are opportunities for you to take action to encourage the leaders of the world to reinvent our world in easy ways that are going to make it, that are going to improve the health of our planet and the health of our people. So with that, I turn the microphone back to you, Emily. Thank you all.
Thank you so much, Ed. It was really fantastic to have you build on and broaden some of the points that Kate already shared with us and add your own research in there as well. I realise we are slightly running behind, so I will pass straight over to Matthew Green to, I guess, pick up from that question that you threw at him, Ed, which is how is it that we can work with the media to get that repetition side, and how does the sort of media framing play into all of those points that we've already heard about in terms of messaging and framing.
Thank you very much, Emily, and thank you, Ed and Kate, for such powerful and informative presentations. Please come to DeSmog and do the same thing. We can learn a lot from all that you have to say on those themes. This is a big topic, And before I dive in, I always like just to take a few moments to take a breath and just let all of that amazing information land a little more deeply in me, and just listen for what feels most important to respond to, acknowledging, frankly, my own fear around this issue. It scares the shit out of me. And that's partly why I'm working for a small non-profit news service called DeSmog that I suspect many of you probably hadn't heard of until you were invited to this webinar. I don't have answers as such, but what I can do is offer you a perspective from within the belly of the beast, from within the media machinery, and I'm keen to pass it over to questions so you have plenty of time for interaction. I started my career as a journalist at the twilight of the last century as a trainee at Reuters, a huge global news organization. Went on to work for the Financial Times, back at Reuters as a climate correspondent. But I'll frankly confess that I found it quite difficult to, shall we say, turn the tanker in the direction of delivering the kind of high impact coverage, calling out the fossil fuel industry and their political enablers that Ed was underlining right at the very end. And so last year I moved to DeSmog, and I'll just share my screen. Rather an appropriate image, I think, in the light of Ed's previous comments. I hope you can read that. Jacob Rees-Mogg saying, we have to stop demonizing oil and gas, speaking to the investment chief at the United Arab Emirates, which is of course hosting the next role of climate talks, COP28, and mindful of the research that shows nobody understands what that is. Very useful reminder there. At DeSmog, we work to expose those connections between fossil fuel industry, lobbyists, other big polluting industries such as aviation, farming. We've even gone into the aquaculture industry from a food justice lens. And our role is very tightly focused on demonstrating exactly the role that the fossil fuel industry and other big polluters play in blocking the kind of action that you will all be advocating for when you take the microphone or you speak to journalists. So please do visit the site. It's just www.desmog.com, and do sign up for our newsletter, which comes every week and will give you updates on all our reporting. Now, in terms of messaging, the first thing I'd like to say is how excited I am to see you all here. Like, for me, when the healthcare profession really steps forward, it's like the cavalry arriving. And I think it was Ed's research that showed you're at the top of the tree in terms of trust. And, you know, I was actually relieved that journalists weren't right at the bottom. I mean, we were certainly in the bottom quarter. But the message I'd have for you is really do not underestimate the power of your voice to shape opinion on this issue. And there have been notable efforts in this regard, but from a journalist, as a climate journalist who's been covering this topic full time for the last 5 years, I can honestly say there's plenty more room for many more of you to come forward. And if work like, or seminars like this can help build up the confidence and the skills you need to do that, I think that's fantastic. I've worked across the media system. I've done a lot of interviews, and for me, it all seems very familiar and very confident. But I recognize that for a lot of people, dealing with journalists in the media can be quite an anxiety-inducing and potentially well, I don't want to say unpleasant, but it can certainly be an experience or a choice that might give one pause. So I guess the first thing I'd say is that the vast majority of media and journalists that you meet are pretty honest, right? They don't really want to twist your words or catch you out. Of course, you know, if you're going into the lion's den on GB News, then, you know, that's maybe slightly different. But by and large, journalists are doing their best to do an honest job, you know, particularly when it comes to healthcare professionals, because we share the same respect for the profession as the rest of the population. So use that power. If you're talking to a print journalist, you can make a deal and say, look, I'm happy to have a chat with you, but please email me back the quotes you want to use so I can check that I've spoken accurately. That's something you can do, and very few journalists will refuse you that because they don't want you to complain and to get it wrong. So you have power that you can exercise there. Likewise, if you're doing a live broadcast interview, a very simple trick that most people don't think of until it's too late is just know the name of the presenter. The producer who's about to bring you on will always be able to give you that information. And if you know that, it'll just give you a certain confidence when you're talking with them. But even if you don't use the name, you'll have this kind of subconscious connection that will help you to speak from the heart. And I think that's also a message that I would emphasize. I think we're moving, and I guess generations of journalists always rather arrogantly appoint themselves of stewards of some kind of inflection point. But with that caveat, I actually do think that we are at an inflection point, because the impact of climate change has become so tangible for all of us. We see it. We saw it last summer. We see it on the news more and more. And there is this fear. There is this kind of lake of fear that is not always acknowledged, but is influencing all of us. Look, speak, whatever the message is, when it's delivered from the heart, slowly, with a few deep breaths, that can really land with people, whether it's the journalist taking the notes or the audience listening on the television or radio. So I would really invite you all to really connect with that when you're going into these encounters. Just drop down from the head into the heart as far as you can. I'll just bring it forward as well. And again, I'm not offering a kind of ready-made solution here, but I'm posing a question in a way, and particularly for those of you who are involved in mental health, which is a passion of mine. My wife is a clinical psychologist who spent many years working in the NHS, and I wrote a book about soldiers overcoming psychological injury in war. And I'm involved in work on healing collective and ancestral trauma. And in my view, the climate crisis is a massive global trauma symptom. And I think that there's perhaps some interesting work to be done in a trauma-informed or even trauma-integrating approach to climate communications, which I think could be very rich. And I have a newsletter called Resonant World, which I write about that, and I'll drop that in the link as well as my contacts. And this group is sufficiently compact for me to say, I'll put my email in. If you're stuck on a media query, just drop me a line. If you're kind of worried about whether to speak to a journalist or want a few tips before you go on air, seriously, just reach out and I may be able to offer you some reassurance very quickly and easily. I know we've hit the time, plenty more to say on all of those themes, but we've come up to the discussion moment, so I don't want to continue any longer. Just to say thank you for your attention and looking forward to hearing any question you want to ask. Thank you.
Thank you so much, Matthew. It's really great to hear your perspective. So we are now moving to the question and answer session. Please feel free to raise your virtual hand and ask a question, or pop it in the chat as well. That's totally fine. While you're sort of getting your thoughts together, I have one for you, Matthew, and then maybe something that people can, the others can answer as well. Do you think that positive climate solutions get enough press? Because I think I see a lot of things in the news about climate change, but it tends to be very negative. And I wonder if part of getting all those messages or elements of messaging that Ed talked about might be having some more of that solution-oriented press.
Yes, well, I think you're right. I mean, we all know that bad news sells, and there's structural and philosophical and political economy problems with the whole media system that go a long way to explaining why we are where we are. So I agree, there's a lot more that could be done. And DeSmog, frankly, is very nichely focused on calling out the interest blocking action. But I agree with you. I don't think very few people have much awareness of the awe-inspiring pace of the energy transition. How quickly countries around the world are shifting to renewables, how quickly the cost. You see, we often hear in the UK, you know, the right-wing press will say, oh, the cost of net zero. It's like, no, we're going to save money through net zero, right? So I think there's a lot of work to be done by the media in terms of informing people that we are actually on the cusp of a new era if we can reach out and grasp it. And there's a lot more good news on that front than a lot of people have assimilated. So I do agree.
Ed or Kate, did you want to add on that? Otherwise, we'll go on to the question. Nope. Okay. Oh, sorry, Ed.
I'm going to pass because I was madly emailing Kate references.
Fantastic. Emily Tweed, would you like to go first?
Yep. Thanks to all the speakers and the organisers. It's been a really interesting session. One thing I'm mindful of at the moment is that the UK is experiencing a bit of a heat wave. And in Scotland, everyone is pretty happy about this because it's quite different to our usual weather. And at the moment, it's still in sort of bearable levels of temperature. We were talking earlier about some of the misunderstandings. I think one of them is about the difference between climate and weather. And so I wondered if any of the speakers had any advice about how we communicate about climate when people are experiencing changes which actually seem quite superficially positive. So everyone's saying, oh, isn't the weather lovely? And I don't want to be the one who says, yeah, but what about the drought that we're experiencing? And, you know, actually this is symptomatic of a much bigger problem. So any tips on that timely topic that I'm grappling with just now?
Who would like to go first on that?
Happy to take a shot at that. I think it's really important that we tell the truth, and the truth is, yeah, right. It's really nice if you live in a cool, rainy place to occasionally have some lovely summer days where you can come outside in your short pants and your t-shirt and enjoy a lovely, warm summer's day or summer's evening. So acknowledge that, but talk about the fact that that is simply evidence of the fact that something is changing, driving the, you know, this lovely weather we're having today. And that something is global climate change that's also manifesting here in our community. So while you're enjoying today, and please do enjoy today, you don't have to be dismally depressed every day as a result of our changing climate. The reality is that changing climate is also creating lots of problems here in our community now. And just bridge from one, it sure is nice today, to the other. Look at all these problems that we are having more frequently and worse as a result of the changing climate here in Scotland, here in London, here in Washington, D.C., where I live.
Okay, Matthew.
I'd love to just chime in, coming back to the metaphor I shared earlier, thinking about how we can talk about the planet as a body. And I agree with everything Ed said, and I might just kind of add on like an idea to think about explaining how, just as the body might kind of feel warm and hot, and that's kind of good, but actually it might be a sign of something underlying. An illness, a fever, a temperature that we need to kind of bring down. And you can still do that, as Ed was saying, in a kind of a can-do way. So that would just be my 10 cents.
Great, thank you both. Matt, would you like to add anything? Or no? Great. Sue, you're next.
Thank you. Thank you, all three of you, for fantastic presentations, really interesting and very powerful. We hear a lot when we're trying to think about how we present things, that actually talking about personal history and talking about personal messages and telling your own story is very important. And whilst there are a few ways that I can think of doing that in the UK, it's not very real, if you see what I mean, apart from feeling very warm today. So I just want, none of you have actually mentioned that idea of kind of personal stories. And I just wonder how important you think they are in this arena around climate change.
I think it's incredibly important. Two types of stories are incredibly important. One is the story that all of us share, which is we are all health professionals. And to start with, to literally lead our introduction to anybody we're talking to, whether it's our, somebody randomly that we're chatting with on the tube or a public audience, it's really helpful for us to explain look, I'm a health professional, and this is why I care about global warming, because it's harming our health and because there are so many things that we can do that will dramatically improve the health of our planet and the health of our people. And that automatically is something that 99.9% of people you talk to will have never heard. So start with your personal story of you as health professional and why you care about global warming. You have just started a successful conversation. Another way another type of story is to talk about people who have either been harmed, had their health harmed as a result of climate change. In other words, don't talk about the numbers, but talk about one person who you either personally know has been harmed, or you have read the account of how they were harmed, how their health was harmed, and or one person who has taken an action that really made a difference. For example, the one person who took the action that ultimately got the coal-fired power plant in their community that was exacerbating the asthma of their child, that one person who led the community protest that got that coal-fired power plant shut down. Those are all powerful stories. And something that I sometimes say is that stories, numbers numb, but stories sell. So hitting people with numbers is rarely helpful, but telling a compelling story is always helpful.
Thank you.
Matthew and Kate, would you like to add anything to that?
Yeah, I echo that 100%. As a journalist, we're always looking for the human story and the anecdote that can bring the story to life. So yeah, absolutely. The personal stories are extremely valuable and should always offer them. Thank you.
And I suppose for those of us working in local authority, public health, or those with sort of a small community remit, it might be about finding some of those stories locally as well. Catherine, would you like to go next?
Yeah, thanks so much for such a brilliant session. This has been so interesting. I have a question about framing and about framing kind of things that are posed as solutions but aren't actually solutions. So kind of greenwashing things and the kind of solutions that large corporations put out about how they are responsible because they are, the one that I really hate is all our rubbish is reclaimed, as if that's the responsible way to deal with waste. So what framing would you recommend for discussing that sort of thing, which isn't just kind of poo-pooing things that people think are solutions?
Who wants to go first on that? Being very polite.
I'll let Ed go first, maybe.
No, you first, please.
Okay. It's such a tricky one, and I get asked this quite a bit. I don't know whether Ed and Matthew have the same. It's a really fine balance, I think, to draw between the conversations that you almost want to happen like behind the scenes without triggering a sense of fatalism. Oh, but you're giving me these solutions, they don't work, what's the point? That's what we're trying to avoid. And I would say that anything that, maybe says, yes, there are really good solutions, these are the sorts of things we want to be seeing more. But I would also say, anything from a greenwashing point of view, it is totally appropriate, I would say, to call that out and point to the fact that businesses need to be taking more action and leaders work on our behalf. We can't be seeing any greenwashing going on. I'd be curious to hear what Ed and Matthew think of that, though.
Yeah, talking, when you need to speak against something as a false solution, as something that sounds good but isn't in fact good, it creates an opportunity to talk about what the real solutions are. So they're among the social scientists who do myth-busting research, they talk about the truth sandwich. So the truth sandwich, you start with a layer of the truth, you talk about real solutions, then you warn people that you might have heard about this solution or this proposed solution, but it's not a real solution, it's a pretend solution. And then so that's the meat, that's the debunking the myth, and then you end again by reiterating the fact, the real solution. So the truth sandwich is fact, myth, debunking fact. And simply by making sure that you're addressing the debunking on both sides of your presentation with the important point that people need to remember, it becomes much more likely that that is what they will take out of the conversation.
Yeah, maybe I could just underscore that. I think you've asked a really excellent question, and perhaps to put it in a wider context, we have seen a big shift from, say, the 90s and early 2000s, where the fossil fuel industry was actively financing to the tune of literally billions of dollars, a whole global network of think tanks set up to cast doubt on climate science, undermine the consensus, and make sure that the UN negotiations didn't go anywhere. And actually, they've been very successful. But we've moved on in a way from that overt science denial, because it's just become almost untenable as a position politically and scientifically now. So instead, and your question exactly put your finger on the problem, we're now being offered by the same industry what we at DeSmog call false solutions. And this is where it gets complicated, because we're talking now about hydrogen or carbon capture and storage and all different kinds of industrial processes that all can sound very impressive and potentially like something we need. And actually, some of the climate models say we do need some of these things. And you can very quickly get into the weeds about the rights and wrongs of this. But ultimately, most of this is the fossil fuel industry finding ways to prolong its life and remain relevant in a low carbon world. So if you're looking for more information to kind of help you get clear, obviously you can drop us an email at DeSmog or have a look at our website, because this is our bread and butter for coverage, is pointing out why these solutions are not what they seem.
Thank you so much. Any final questions before we go to our mini peer discussion section? So there was one in the chat earlier, which was, I think for Ed primarily, was about, are there any plans to test the messaging that you mentioned with UK audiences, or are we sort of happy that we can kind of read it across from the US?
My own team has no such plans. I hope that our colleagues in the UK do have those plans. Sue might be in a better position than I to know if that is in the works.
Any thoughts, Sue? Or I know, Kate, your organization have done some messaging and work as well, haven't you? So
it wouldn't be our kettle of fish.
So,
sorry, Sue.
sorry, I don't know of any offhand. I'm afraid I'm not totally in this, specific communications world. But I think we ought to explore what researchers there are. Kate probably knows them all very well.
great. Okay, any final questions before we go to peer discussion? I can't see any hands. So the aim of this section is for us to go into small groups. So sort of 3 to 4 people, and just spend 15 minutes discussing some takeaways from the session, and then come back for a final round of any further questions, basically. So if you're able to stay for this final segment, that'd be absolutely wonderful. Okay, and Ed may need to head off now, but that's fine. So Anna, are you able to start putting us into some mini groups? And we have a quick discussion template that you may like to follow as well. So Anna's posted that in the chat, and we can share that again if you've missed it. Here we go. Get everyone back. Hi everyone, thank you so much for coming back for this final few minutes. The idea of this is just that we can hear from anyone who wants to volunteer, any thoughts, any insights from your discussions in small groups, and any final questions you may have for Kate and Matthew. Anyone gonna put their head up above the parapet to go first? No pressure at all, but
just while you're waiting for the hands up, I've just popped a couple of links in the chat. So there's the evaluation survey. We'd really welcome feedback. And also, if you're not already a member of the faculty special interest group for sustainable development, please consider joining. And I've put the link to the membership form and the email address in the chat as well. And also all the way through the chat, we've had links to the organisations mentioned by the speakers. We'll make sure that those go in the notes when they go out. But yeah, do support the organisations that have kindly provided their time today as well.
Great. So any final thoughts, questions, anything at all to share back? Otherwise, I can go for one of my burning questions, which is, I suppose you both mentioned sort of examples of messages and campaigns. Oh, here we go. Caroline, you can go first. I'm sure your question's better than mine.
It's not so much my question, but one that Jasmine raised in our group, which has got me thinking. So we really enjoyed all the speakers, and I think what's really clear is the need to build our narrative and to have a consensus around that narrative, and for that narrative to be positively framed or solutions framed rather than positively framed. I think that's really important. And Jasmine raised the point that often what we do in public health is we think about different population groups, and often that different messages need to be tailored for different groups because we all have slightly different needs and we're all coming from slightly different places. And I just thought that was a really interesting point, because actually inequalities is really important, particularly to the climate change agenda, and for us to make a just transition and to take people with us. I wondered if there were any reflections on how we could consider that in our approach going forward.
That's a really, really good question. Kate, you're looking like you're poised to.
Apologies, I've just got a bit of background noise. I'm going to put something in the chat really quickly and let Matthew take this one if he wants to.
I was hoping someone else would answer that question. I mean, I think you're right. Obviously, you have to tailor your message to your audience. Absolutely. I mean, but then from there, you have to just trust your intuition and figure it out. But you're right, definitely. I absolutely endorse the idea that the way you speak and the tune is going to be different depending on the kind of demographic you're speaking to. And I do also appreciate you raising the issue of inequality, because let's face it, it is the poorest people who suffer first, whether that's in the global south or in the UK. So it's a really important dimension of the crisis that we need to keep returning to. So thank you for bringing that forward.
Yeah, I think it's a difficult one, isn't it? It's the sort of justice side of all of this, and it's something that in our messaging and in our solutions we need to be really conscious of. I'm not aware of any research that sort of goes into messaging specifically for some of those most deprived groups, but if anybody is, it would be really, really interesting to see it. Maybe we can be a hive mind on this. Does anyone else want to come in on that?
Kate's posted in the chat a link to the Britain Talks Climate, which she mentioned earlier. I have also had a look at that, and I think I would echo, I think it's really worth a look and worth a read. It doesn't necessarily specifically address what you were mentioning, Caro, but it is useful in terms of thinking about different segments of the population. I was going to say, I think as local public health practitioners, people will have a really good sense of what is important to and what the values of their communities are. That's part of our job, and so we should make use of that general knowledge about what's important to our communities in any communication.
Great. Kate, did you want to just?
Yeah, I was also just going to say, sometimes the BBC has some good research and audience insights that's worth looking at, and they do kind of have it on their press Twitter, or just kind of keeping an eye on the sort of stuff they're putting out. But what I would say is, like, the sorts of audience insights and audience segmentation that you can use, like, I generally find that most helpful either when you know exactly who your audience is, or you have like a huge comms budget. So I would kind of always be confident framing everything in those big kind of ways that Ed, I, and Matthew were talking about earlier, then kind of bringing in that specificity. And yeah, the other thing to say is framing climate justice might do some of the job that you were talking about, but it won't do kind of exactly what you're looking for. I put that in the chat.
Fantastic. Any further thoughts on that, or any other discussions you had in the room, or any final questions? If not, we would really encourage you to fill out our evaluation form, tell us what you want next. We recognise this is sort of opening a can of worms in a way, because there is so much to think about and talk about when it comes to climate and health communications. So we're really keen to understand what kind of training, what kind of speakers, what kind of activities people want next to continue this journey. So please do fill that out and let us know. We will save as many of the links as we can and circulate those, and with permission from the speakers, we'll hopefully also share slides so you can have that to refer back to in the future. But yeah, massive thank you to Kate and Matthew, and also Ed, who unfortunately had to sort of drop off, for joining us. Really appreciate your time, and yeah, thank you for everyone for attending as well. It's not a short meeting, so appreciate it.
Thank you.
Thanks, everyone.
Thank you, everybody.
Thank you. Thank you.
Bye. Bye.
Okay, to save the chat.
I was going to say, are you doing that, or shall I? I might do it as well, actually.
Yeah, double.
I'll just stop recording.
Thank you.